and OB fistulas. So what is a fistula? A fistula is an abnormal opening between internal organs or between an organ and the exterior of the body. GI fistulas are abnormal openings that allow stomach or intestinal fluids to leak. Internal fistulas connect the GI tract with other internal organs, peritoneal and retroperitoneal spaces, the thorax or blood vessels. External fistulas occur postoperatively and create abnormal connections between the GI tract and skin. Up to 85% can result from abdominal. Causes of a GI fistula. Most GI fistulas occur after surgery. Other causes of fistulas can be from a GI obstruction, inflammatory bowel disease such as Crohn's, diverticular disease, abdominal radiation during cancer treatment, trauma or penetrating wounds such as a stabbing or gunshot, perforations of duodenal ulcers, or infected aortic grafts. The signs and symptoms of GI fistula are abdominal pain, diarrhea, malabsorption of nutrients, and dehydration. Internal fistulas may have no symptoms. Extracutaneous fistulas, also known as external fistulas, can leak intestinal contents through openings in the skin. The diagnoses are endoscopy or colposcopy to determine or rule out IBD. Fistuloscopy is rarely used as it may tear the opening even more. Cystoscopy allows for visualization of the fistula within the bladder. Serum levels to check are albumin, sun, creatinine, electrolyte levels to determine the nutritional status. Urinalysis and microbiology are used to determine urine cultures and abscess cultures from antibiotics. CT and MRIs are also used. Treatments for fistulas would include the assessment of pain, abscess formation, local infection, nutritional deficiencies, and recurrent septic state. Some of these fistulas can close after a few weeks to a few months. Some patients may need to receive nutrition through a vein or tube feeding during the healing process. Others may need surgery to remove the fistula and parts of the intestine.
OB fistulas are abnormal openings within the urinary tract caused by gynecological procedures, childbirth, and cancer. Where does an OB fistula form? The fistula can form in the vesico-vaginal, causing urine and/or air to leak into the vagina. Rectovaginal, where bladder and feces can pass into the vagina, which most common type of symptoms would be UTI. Urethrovaginal, where urine leaks into the vagina. All of these may result in excoriation, irritation, and infection. Diagnosis of OB fistulas. The visualization of OB fistulas is quite easy to confirm upon examination. Diinjected of methylene glue into the rectum on a tampon, and the examination of the vaginal tampon after 15 minutes can establish the presence of a rectovaginal fistula. Treatment of OB fistulas would be if they heal on their own within a few months. If they do not heal, surgery is required. All edema must be done before surgery can take place, as this can take up to 6 months. This results in the patient needing a temporary ileal conduit or colostomy. Personal hygiene. You need to make sure that you're cleaning the perineum every 4 hours, providing warm baths 2 times a day as possible, and changing pads frequently as incontinence may occur. Catheter and/or colostomy care. Encouragement of adequate oral fluid intake, and reassurance and emotional support is needed if wetness or offensive odors can socially isolate patients. Emotional trauma. In many parts of the world, research has shown that women become outcast in society due to the uncontrollable urination and offensive odors caused by OB fistulas. Being a woman in the United States is fortunate as we have easy access to medical treatment. During our research, Scott and I discovered that it is not all women across the world are unfortunate, and that OB fistulas are actually quite devastating. Without medical treatment, many of these women do not survive and endure great lifelong emotional trauma. Please click on the hyperlink to see a short film called Love's Labor Loss about the emotional trauma these women suffer from.
That is our presentation. Thank you very much.